let's go over the second round of exercises that I would give patients after their total knee replacements. This is after giving them their quad sets and heel slides, the basic bending and straightening exercises where you're laying down. These exercises that I'm about to give you include more weight bearing and strengthening while also improving the mobility of your knee. The first one that I usually give is something called calf raises. Pretty self-explanatory. You're basically just raising up onto your toes while standing, and this serves two main purposes. One is that it's helping also prevent blood clots, similar to how ankle pumps would, where you're just laying down, just with more of a strength component to it. The second is that it actually helps strengthen the muscles of the gastroc and the soleus, your Achilles muscle, because they help with bending your knee while you're weight bearing, while you're standing. So this is a big part of helping you get back walking normally, reestablishing that heel toe pattern, or again, just walking normally so that you can have a normal knee and feel normal with your walk as you go along. The second exercise that I typically give people after the calf raises or in the second round is standing marches. Now, I give these specifically at the beginning because I want the patient to work on being able to weight bear on their operative leg. So that basically means standing at the counter, holding on to something. You're going to be marching one leg, alternating after the other. And I usually tell people, I don't care how high you bring up that surgical leg. What I care about is that with that surgical leg, you're able to hold a little bit of weight on it as you lift the non-operated leg, right? So you're getting used to standing on that leg and strengthening those muscles that support that. And then the third exercise that I give in the second round is something called standing knee bends or hamstring curls, you can go by. This also specifically works on bending the knee, but in against gravity. So the heel slides on the bed are typically gravity assisted or gravity eliminated, so it's not really causing a strengthening component. These actually help you get a functional way of bending your knee, as in how you'll be walking around bending your knee throughout the day and getting that strength back. So let's go over the key points of performance and how often I want you doing these exercises. Now, typically I would say for most people, I want you doing about 20 reps of each of these exercises, and that counts for each leg, 2 to 3 times a day. That can vary depending on your tolerance, so if you're having a lot of pain or any issues, comment down below so that we can try to find better solutions for you, or I can offer better guidance for people in your situation. So, calf raises, starting off just on the flat ground. What I want you doing is just raising up on the toes 20 times. You can use your hands for support to get your balance. It's not a balance exercise, it's more of a strengthening exercise, right? As you progress along, what I would want you to do is to get onto a step, also with arm support so you're not losing your balance, but getting your heels off of the step so that you can increase the range of motion. This, along with helping the knee flexion muscles, like I mentioned before, the gastroc and the soleus, will also help you get back that last little bit of knee straightening typically, because these muscles also, as they help with knee flexion, knee bending, they also help stretch out into that knee straightening position. So that 2 to 3 times a day, 20 times or 20 reps each time you do it. Marches, points of performance, again, I do not care how high you get that operated leg. All I care about is that you are trying to bear weight on the operated leg so that you can get used to it and get better at walking as a result. Again, 20 reps on each leg, 2 to 3 times a day. And then the last exercise in the second round of exercises I give patients after the knee replacements, standing hamstring curls, standing knee bends, whichever you prefer to call it. It looks similar to the march, but you're just trying to think about getting your heel as close as you can to your butt. And especially early on after surgery, I do not expect you to be getting it up very high. That is completely fine. Just go within your comfort to mild discomfort level, and then try to continue doing 20 reps of that 2 to 3 times a day so you can build back that bending strength in your knee. Hope this helps. My name is Connor Ganser. I'm a doctor of physical therapy. Like and subscribe for more videos like this and helping you along with your knee replacement journey.